I'm Kathy Harshbarger, for those of you that don't know me, most of you do. I was either going to have no crowd, a small crowd, or a huge crowd, and so I guess I've got my small crowd that's kind of comfortable right now for me. So for those of you that don't know, I grew up in Wyoming. I'm a Wheatland native, so I was born and raised there till about 6th grade, and then we moved to Laramie because my parents both worked for the University of Wyoming, and so we spent our middle school, it was junior high then, junior high and high school in Laramie. I grew up at 5 years old, declared I was going to be a nurse, and followed through on all of that, which is kind of awesome, right? So I became a nurse. I live in Wyoming, and we really had junior, guess what, we still have junior colleges and one college, right? So I got my associate's degree in nursing, and then later, well, I actually started out as a candy striper, if anybody knows what that is, and then went on to become a bachelor's prepared nurse. I went through the University of Phoenix. I actually went to classes on campus and off campus online. It was too hard for me to be able to afford going to school and taking care of my kids and stuff while I was going to school for my bachelor's and in Laramie. So that's why I went to the University of Phoenix way. And then later on, I got my master's in health administration. I'm really only about 4 credits away from master's in nursing, but I was done with school by the time I got done with the master's in health administration. My career has been a little bit of everything. I've worked I worked in clinics, I've worked in nursing homes, hospitals. Most of my career as an executive has been with the hospital rural health clinic type of setting. I've done I've had an executive presence for about, I almost hate to say it's around 20 years, 25 years. I'm trying to remember off the top of my feet here. And so I feel like I've got a good background. My love and passion is rural communities and rural healthcare. And I really believe, I just got to get this one in, we are more than a Band-Aid station, right? We provide care for people and save people's lives on a regular basis. And so I'm always excited to be part of a team that can do an area of care for the community. And it's nice that Weston County Health Services provides many services for the community, our clinics and our ER and our hospital unit and our manor. Those are very important. Those are very important to us. We have the Upton Clinic. It's had a little bit of work getting ourselves fully staffed for there, but we're getting there, and we're excited about our future. So with that, I wanted to introduce Shane Filipi and have him come up for a minute and talk and introduce himself. He's our nursing home administrator.
Hi, I'm Shane Filipi. Like Kathy said, the nursing home administrator. So a little bit about my background. So I've been an administrator 15 years now. Started out in Kansas, then Nebraska and Wyoming. I've lived in Wyoming 2011, been in Wheatland. So kind of bounced around, but did run Wheatland's nursing home for about 10 years. So helped them build a brand new one down there. So yeah. Happy to be here and happy to be working with all the staff. So,
thank you. Then we have JT Swiney. He's our Chief Human Resources Officer.
Well, most of you know me. I want to say first, I'm very thankful to be a part of the team. I think Kathy and the leadership here has done a great job getting together. A little bit about my background. First off, I really love rural health care. I think it is such a tremendous thing to be able to come in and see all the services, all that we really offer the community that most people really don't see. And so we do offer a lot to the community. My background is also a little bit different. I was not raised in Wyoming. I am a transplant to Wyoming, but I grew up in PK, which is a pastor's kid, and that was kind of like being a military brat. I've lived just about, my dad drove us every 2 years to a different state, to a different location, to a different place. And so we had to learn how to become versatile and how to adapt. And so that's been a great part of my life. I served as a local pastor for about 25 years. in different areas, which put me in places like Fargo, North Dakota, where my daughter was born, or Windsor, Ontario, where one of my sons were born. And so we've just been able to adapt and get to a lot of great places. And coming from the Upper Peninsula of Michigan, 250 inches of snow per season, 30 below zero on average for weeks on end, lots of hunting and snowmobiling, so we really like and love the area. So I also have a background, bachelor's, master's, PhD, and then go back for business administration and human resources. So mine is between divinity, religious studies, and then business and health, human resources. I have worked in rural healthcare. I came from a rural healthcare, Critical Access Hospital in the Upper Peninsula, where services are very hard and few and far between. So our hospital was very, very important to our community and still is. Before that, I was pastoring and serving as HR director and operations director for a group of pediatric clinics. And so I absolutely love healthcare. I love what we offer. I love the future ahead of us. I think that we have a great team and Kathy's leading, and we are really excited about where we're going. And so we're just happy to be here, and I'm happy to be in Wyoming. And so I officially live here, and I'm not going to get run away from the winter.
And we also have a person named Tish Miller who's going to be joining the team on November 4th. She's going to be our Chief Financial Officer. So we'll actually have a full complement of executive team. And I think that's really, really important because you say, how did we get here, right? We went through a really tough time to get to where we are again. And now, I guess I would say, financially, people probably wondered what the heck we were doing, and that I think that's a fair question. But I think what I want to say about it is that we've really been doing work and catching up work that was about 18 months behind. So we have been really, really busy trying to get the 18 months back up into the current time that we were supposed to do financially. But we're also in the process of moving forward. So we kind of have our feet in both places. What can we do to make sure we do all of our regulatory and obligatory things, fiduciary responsibilities, get those all caught up and be accountable for those results, and then also moving forward, how can we do a better job? Because quite frankly, that's what we needed to do, is do a better job with our financials and really just even the environment and the culture that we have in the facility. So with that, I am open to questions. I'm going to answer every question that I can. If there's a question I don't know, I'll have another town hall meeting and have a plan for answering that question. I have some people recording the questions so that I can make sure that I get those right. But hopefully I can answer most questions. Hi. Okay, is there anybody that wants to start?
I will.
Okay. Yeah, go ahead. Kim.
The mill levy is on the ballot. You're asking for the additional 3 mills, a total of 6 mills. So what do voters need to know if that doesn't pass? How is that going to affect this?
Thanks for the
Will
question.
services be cut, or?
I think the important thing to know about a mill levy is that we're not unique in having that. That's number one. Mill levies are what real facilities really count on, especially hospital districts, because we do have low volumes and lower volumes than an urban setting. So therefore, we're not as efficient as those bigger settings. As a result of that, we still have to have enough people to safely care for people. But we aren't necessarily as efficient as an urban setting where they have more volume to be able to work with and offset some of those costs. And so the mill levy really is about our interdependency on each other. We're dependent on the community for the mill levy because that's part of what we bring in to be able to afford things like capital expenditures and quite frankly, just any kind of operational pieces that we have, it adds to that operational piece. I think it's important to know taxes don't go up with this levy. They would be reshuffled basically someplace else. But the levy doesn't make our taxes go up in the community. The levy is important to us as well because, yeah, I think that what happens is if we don't have it, we're going to have to be faced with having to survive, right? And that survival part can be, well, we're going to do our best to keep everything in play, but the truth of the matter is if we don't have that levy, we will likely have to cut some sort of service or some sort of, business onto the staff because it's important for people here to take care of our patients. And I don't want to have to make any decisions relative to that. And I've got a lot of staff out there. That would be one of my last decisions that I would make. But we will have to we are looking at different models. We're looking at the model where we can stay the same, or is there a model where we have to go to something like a rural emergency hospital? And the rural emergency hospital basically takes the inpatient side out of the facility, so we would lose a service line. But we would have the ability for observation stays, ER, and all of our outpatient stays. And some people may say that's a drastic move, but what happens with that is that HRSA is part of helping small facilities to survive, and they give you about $3.2 million back for going into that kind of a model so that you can at least keep the services in the community that are needed. I don't know how many of you have had to use the ER, but the ER is a very important place for people. We save people's lives there every day, so that's why we're not a Band-Aid station. And we take care of people in motor vehicle accidents. We take care of people regardless of their ability to pay us, and we do have quite a bit of self-pay. I was just looking at the numbers last night, and it's around 30% of our money. It comes through self-pay. So we have to have a way to buffer that because that self-pay oftentimes comes to no pay and it's basically bad debt or charity care that we provide. Have I answered your question?
I think so. So you would still be able to offer the swing bed and inpatient therapy?
We would be able to offer swing bed. It would just be under the manor. So it would be in the same place. It would be under the manor. It would be called a skilled nursing visit for a patient that was there versus a swing bed patient, but doing the same activities, the same therapies for them, the same pieces. But yes, we would miss that opportunity to be able to have acute patients in there that we're going to stay like 2, 3, 5 days. We can keep people for observation up to a couple of days, but we can't go beyond that. I think it's really important that the community think about what they want for services. I personally want to have the services we have now and grow our services from there. So I've talked to a pediatrician, talked to an ENT person. I'm looking at who we need to still hire for the clinic to make that get better. And I have some ideas about talking to kind of having a competing conversations with Monument Health and with Hoskinson's clinic, because they have a lot of specialists to see who we can get to bring forward. But I think it's important to remember where we were long enough to know that we don't want to go there again, and we need to move forward and do what we can to provide all the services. My goal in life would be to be able to provide all the services we have now and more. So that would be my goal. But if I'm left with decisions because they don't have that levy money, then I'm going to have to make bigger decisions, harder decisions with the board to decide how we keep things running steady. I don't think that any of us would want our manor to go away, for example. I don't think any of us would want really the hospital to go away. So yes, we deserve some kicks in the butt for some of the stuff that happened around here. That's the word I'm going to use. But we're trying to get that taken care of now.
Thank you.
Mm-hmm.
Can I pass this to someone else?
Anybody else want to ask a question?
There was a lot of fear about retribution if anybody spoke up previous. I don't think this is on. I don't think I need it.
Yeah.
Previous to you coming in, and I'd hear about it, and to the point where I'm not even going to mention names of who I heard it from, ever. Mm-hmm. It's just not going to happen. What are you doing, on the record, what are you doing so that the employees that are here some of them that have worked here for years, are not afraid when they see something that may be going wrong, where they are going to be allowed to speak up without fear of having retaliation come against them?
Well, that's a great question. And I think the answer is probably ask some of the employees, but the truth of it is I round on people a lot. I spend a lot of time with the staff. We talk about problems together. I'm not one to beat somebody up because something went wrong somewhere. It's more about how can we move forward together as a team. We talk about what we need to do better, but we don't talk about who made the mistakes and why we're in the mess we are, right? We just talk about how can we move forward to be a better facility. And it's been, well, the truth is I was the interim CEO because I lived in the community and I felt mission-minded to be here because I felt like I could help when I was reading all the papers. And I'm still mission-minded, and the board and I talked about me coming on board, which they asked me to come on board, and I have decided to stay. And I decided to stay because of the people. The people here, the staff that are here are good people. They do a good job. I feel like they need education and training, but I don't feel like they need beat up or any of that sort of thing. And with that, I think that's kind of what I would say. It's really about being around and being present and being kind and not trying to find blame with people. So, and not jumping to conclusions because on one side of the fence or the other when there's something going on between the team. I usually bring them together. They can tell you that I do that, bring them together so that they can work things out. So I'm on the record as saying that no one should be afraid of me, and I don't think I have too scary of a presence. I've gotten some nice little indications from people that I'm okay, so that's the best that I can do is try to be honest. I have a lot of integrity, so we do things the right way, and that's important to me. It's pretty much as simple as that. It's a simple recipe of kindness and integrity, work hard, be partners. I'm very collaborative, so I have a lot of collaboration with staff.
The other question I have, and these are coming to me from what I hear other people say, obviously they come to me because I'm at these meetings, I'm broadcasting them live, and then I hear about stuff afterwards. And one of the comments I have, mostly from people that aren't even working here, and I'm not going to say it's been a ton, but there has been some. And it feels like anytime that the board has a chance to go into executive session, they take it. Where when you look at 15-4-405, under all of that stuff, you can, it does not say you have to, under certain things. I understand there being necessary times of executive session for stuff that's confidential by law. Probably personnel issues, I could see that being a bylaw. But there are times they feel like that the board is just, if they can, they're going to take that opportunity and go into executive session. That is frustrating people because they feel like secrets are still being kept. What would you say to them to help alleviate that fear?
I think that I would say we're getting better. It's a new board creation, and I think that over time the transparency is getting easier and easier for people to understand when we should do that, and we know we should do that. So what I say is look to the results you see going forward, because I believe that we're getting better about talking about things. For one, I'm pretty open to talk to anybody that talks to me. I'll tell you what the numbers are. I'll tell you what you want to hear. So I believe in transparency, and I think that I can't really speak for the board, but I will, and as much as I can say that they're getting better at that, and they're starting to be able to feel comfortable with what they can and cannot do. Because there's a whole human element that goes in there, and you're always trying to figure out, is this something I need to keep with the human part, or is this something we can talk about out loud? And I just say going forward, look for more transparency. Is that a fair answer? No. It's a fair question.
I'm not sure it is a fair question, but I think that's an okay answer, yeah.
Yeah,
You answered my question, but it's basically, I think people, I guess you could address it this way. I think people want to see results now. I know it takes time. So maybe you could address it that way, and I think you did, saying just watch us going forward. So, yeah, I think that's a fair answer.
yeah, I think watch us going forward, and we have a responsibility to the community, and we need to be able to hear those voices, whether it's from them directly or through somebody else. So I'm a free speech kind of girl. I've lived in Wyoming most of my life, so I can tell you that that's important to me. And it's important to me, if bad news, good news, ugly news, we can talk about it. That's important. Yeah.
Can I say, I think that they can already see the last board meeting.
Yeah.
Most of it was done, there was only like 10 minutes of an executive session. And the majority of the regular schedule was many hours.
Yeah.
That was public, so I think it was very short.
Well, it's up to the people to tell us if we're doing a good job on that, so you guys keep us informed on whether we're doing a good job on that or not. But I'm gonna say we're gonna do a better job. Anybody else, questions?
I'm not sure how to bring that on.
I'm mostly just pretending. So you know who's talking. But that first question was geared toward, Kathy, are you approachable? Are you scary? And it's hard for Kathy to say it herself, like, I'm very approachable. Of course I'm not scary. But as a staff member, because I work in the ER, and I've been here for 4 CEOs now, which unfortunately that just means 2 years. But Kathy's incredibly approachable, and she's brought on an air of peacefulness, of not being worried about every time you turn around something being negative. The culture is, among those of us who work here, has shifted in a very pleasant way since Kathy came on, of feeling like things are secure, and if a hiccup happened, if something did happen, that somebody's gonna come to you and talk to you, instead of you just finding out later with a pink slip. It's been a big culture shift with Kathy in a pretty short period of time, and it's been a blessing for us.
Thank you.
Thank you.
Thank you. Any other questions?
I have one.
Okay.
Does Weston County Health Services still have the same legal counsel that we had when some of the issues arose in the last few years?
We do. We have Lovenell, and I forget the second part of their name, but we have that in Allison Gee right now. So we do have the same legal counsel.
How is that vetted?
How's that vetted? Well, I think at one point or another, the board, and I'm sure it was a couple of boards ago or so, because I think Allison's been doing it for quite a while, the board approved that firm to be able to work with us. There has been discussions within the board, I'm sure they'll be seeing this, about whether that's the right fit for the organization going forward, or whether we need to make some changes. And so I don't know what will come of that yet, because I'm here to support the board and to do what I'm supposed to do. But as far as right now, Allison is still our counsel.
The new store. This is the one-stop shop. We have a pharmacy. We have a bootlegger's liquor. The deli, the food that you can get at a lunchtime is so amazing. The coffee shop. Certain Friday mornings, there's 30 people sitting here in all these chairs. This is the hub for people to come and visit, have their coffee, have their donuts. It's amazing what this area has done. Totally amazing.
You had mentioned hopeful future services that you would like to see added to this hospital. Where do you see that going if the mill levy is voted to continue?
I think we need to bring in more specialty clinics to be able to have people not have to drive so far to get their care. So, I have a pain management clinic that's interested in coming. It's a lot of hoops to get there, but we could work towards that. The ENT, the pediatrician, I think that we could really use a cardiologist. We could use, I don't know what we could use as far as if there's somebody that's willing to come down and work with the patients that have like end-stage kidney disease, nephrology or something, that have to still look at that. But the other thing is can we take part of our space and dedicate it to perhaps doing endoscopies, and so people can get their colonoscopies, they can get their endoscopies done here and not have to drive so far to be able to get that done. I think that we haven't, maybe, I don't know if we have or haven't tried, but I know we need to try to leverage we get a lot of business to these other hospitals because we send people to them and we send them to the specialists, and so really we are going to be asking them to give back to this community and provide the services that we need more locally. It won't be as robust in the fact that we probably get them once or twice a month or something like that, but at least we'll be able to start having services. And then as we grow, maybe that will work. Home health gave me the idea that another county is Crook County, I think it is. I'm trying to remember, but is Sundance Crook County? Yeah. Sundance and some of those neighboring communities really need home health services. They don't have them. Could we open, we have a couple of people that were willing to partner with us if we opened home health a little broader so that we can catch those people in that catchment area as well, so that we could bring services to those people, which is the first and foremost thing, but also that's additional revenue for our county to be able to support those other communities. I saw your...
That's what I wanted to ask is when those specialty clinics come here, do they pay us rent?
Yes.
Or do we pay them to come? How does that work financially?
Well, it can depend, so I hate to sound like a lawyer because that's what they say, but sometimes, a lot of times they come and they rent space, and then they get to have the advantage of being at a rural facilities. So when they're at a rural facility, they actually get paid a better rate for their services than they would.
By the patient or by
the patient.
Who pays the extra for being in a rural area?
The government does, the Medicare piece of it pays extra for that. So some people come and they just pay for the rental space. Some of them come and they will say, we're going to come and we'll see the patients, but you do the billing and everything, and then that arrangement's different in that we bill ourselves for that service. It really depends on the provider, how they like to work things out. So you can do either one.
So we do get a percentage or something?
Yes, we get either the rent or we either get a billing availability, at least for the clinical component of it. So, yeah, that would be nice to be able to have that. Yeah.
I guess so.
Hi,
I have a little question, but I noticed that there's a lot of spaces available for people to be here, but not staffed enough to have enough nurses or, people to care for them. Is that true? Because there's all those blocks that are open.
Oh, those spots that are open, there, in healthcare, seems to be this chronic need for somebody, and we're no different than anybody else, but I will tell you, we're probably better staffed than most critical access hospitals I've been in. So that's the good news. The bad news is, we still, we just had a CNA class because we're trying to get CNAs. We're doing pretty good with nurses, but we could use a couple more, right, Donalda? A couple more? And Melissa, a couple more. So we do have some openings, but really, we do pretty darn good, I think. The jobs that we are looking at, radiology, I think, has got a job open now. That's just because the person's moving back around their family. And anything else, guys? I personally feel like we have a pretty good staff.
So the manor that's not in use, I guess, or I thought it was supposed to be for male dementia unit or living in the manor anyway. And it's because of staffing we don't have it, or what's going on?
Shane, do you know?
We actually have residents in it, so it is something with them looking at our admission process, all that, revamping that, so we can.
What is-
take more, and staffing is more about being efficient. So we're looking at the efficiencies with it to make sure we have coverage at all times.
So what is the capacity of the manor?
It's 58 is what it's licensed for, so.
And how many do you have?
We have 40 right now, so we just lost a couple, and we're currently looking at a couple more right now.
So what is the plan to get it up to full capacity?
So with long-term care, it's kind of like a wave. I mean, census always goes up and down, so a lot of it depends on what time of year it is when you're trying to get your census back up. So right now, we are kind of in that lull right before it'll start picking up as the weather starts changing. So some of that's just waiting for that. I mean, people need us when they need us. There is a wait list, but the wait list isn't people who are quite ready yet. So a lot of it will be doing marketing, getting out there, making sure everybody knows, hey, here's the services we offer. So
But you don't have staff to have 58 patients, correct?
at 58, I mean, you'd be talking an increase of 18 residents, which would be a lot right away, but that's not going to happen right away. So when you say do we have enough staff for 58, no, but we'll build up to that. It won't be just overnight. So am I confident if we go up to 6, 7, we can handle that, but 18 is not going to happen.
Well,
tomorrow, so.
and this was before your time, but, you know, the CEO at that time asked the voters for additional mills to build more because they needed more space in the manor to take more residents in. So probably quite a few of us in this room voted for it. And so for it not to be used as a concern, because you voted for that.
It was full up to 58, and then when COVID came around, they lost COVID, and that was before my time. So then you have the atrophy of those residents that caused that Unit 6 to be then empty. So we're trying to build up to that.
So I can actually speak some of that. I mean, you look at census statewide, there's, I think, 2 buildings above 80% right now. So you're just looking at Newcastle, you take a step back and look at the state, and COVID was hard on long-term care, extremely hard. And the industry of long-term care is just coming out of that right now, getting that staff back. And all healthcare lost a lot of staff, but long-term care, it was not good. So census as a whole is down everywhere, so it's going to build that back up.
Is there any space for male dementia?
Yep, most definitely. So, yep, we will make sure and figure out how to make it work for any locals that need the service. So, yep.
I think that I'm going to say that we're making sure that we're not being overly too selective, so to speak. We make sure that we have people we can manage. But I think that, well, for a while we were being a little constrained in that thinking process, and now we're opening up to the possibility of more. And as far as money going towards improvements, there was some money, we have some money that we're improving some floors and things like that needed some replacement done. There was some grant monies that we were going to get that, quite frankly, we lost because there was architect drawings done. We got paid back about $325,000 of that we spent. However, we didn't get the rest of the money because I literally had 2 days because of all the fund I've come into to be able to try to get a contract for us to move forward to get that other 100. So I had no choice but to fiduciarily say we can't do it because we can't get it done that fast and give the money back to the state. But the good news is we can go back to the state later and look for opportunities for funding. There was neglect on the parts of people before on getting some of these things moving forward. And all I can tell you is that I have a lot of investment in being high integrity and to be the right person. So we're going to move forward to meet our community's needs, and we're going to do that with diligence and stay on top of that. So that's the goal I have for the community. And so those broken promises, I wish I could undo, but I can't. But I can tell you, moving forward, our team is very willing to move where we need to move to be able to have our facilities. And I gotta say this, you know, our staff, all that we have here, if they weren't in the community because something happened to this hospital, the economics of this community would be bad. The economics would be bad. So it's really, really important that we look at our interdependency, because we very much are dependent on the community as much as the community is dependent on us. We had a bad season, and trust me, I feel it every day, but we're working to get it better, and it's coming along, and we're doing good things. And I think that we'll keep talking to you guys so that you see that we're doing good things. We're trying to be out in the community more, various ones of us, and I think that you'll see a difference. But you're right, we let people down. We have to do a better job. And so I'm saying that I have to take responsibility for that. Whether I did it or I didn't do it, I have to take responsibility. So the answer is we screwed up, but we're not going to be doing that anymore.
How much more does it cost us to have a visiting doctor, a rotating emergency room people that come from other places? How much more does that cost us than if we had resident doctors or nurses?
You mean ones that live in the community? Or, yeah. Well, that's a hard question to answer, because we try to have people in the community. We do have several from the community or surrounding area that work in the ER, but it's about supply and demand types of thing. You have to find the right ones. Truthfully, you got to get providers like Dr. Franklin, who live here, our community here, they want to be here, and they have to be mission-minded to live in a rural area. Otherwise, you just rotate them every 2 years or something anyway. And so they're expensive. Do I wish I had all local people? I would. Do I think it's realistic that we'll always have only local people? No. Just because of the type of dynamics of the services that and where people want to live, basically.
Do we still deal with an agency? There's a middleman who, you say, emergency room nurse, and they send one or they find one?
Yeah, we use travelers. That's what we call them, is travelers. We do use some where Manala's picky about it, so is Melissa. They try to pick the best ones. But we use them so that we can make sure that we meet the community's needs. And of course, we'll work on our recruitment strategies. And we are still working on our recruitment strategies moving forward. The other thing I wanted to mention is we can't get too far ahead in staff to what our volume is, because if we do get too far ahead to our volume, then we end up with a real big problem because we have too much money we're spending. So we have to spend it wisely. And so we will gradually move up, and then we can prepare to have more staff. And sometimes you do that through a temporary use of travelers while you're building up that staff. But that would be the goal, is travelers for nurses and stuff. We don't want to have them in the community all the time. And it's not because we don't like them. There's not likable people. And it's not because we don't need them. We do sometimes need them. But we really want to be our own. We really like being our own people. We like to be, we're proud of our community. We're proud of being part of the community. And we'd rather have our own staff.
We've seen, and not just here, other agencies around town where they try to open up training for new whatever position that they want to fill, and it falls flat so often in a county this size. What are you doing that you think might improve that on training, recruitment?
Well, we have some things we do, like referral bonuses for staff that refer people. We have some sign-on bonuses. I personally like those going steps, so people have to stay here longer to be able to get all of that bucket of money. As far as our recruiting strategy, it needs to be a little more robust, and that's actually part of what we're working on. But quite frankly, until I started getting more help, I was just trying to make sure the doors stayed open, and I was taking care of all the letters I got from Medicare that were not love letters. They were get your act together and get this stuff done type of letters. So we need to do some more work on our recruitment.
Now, you've had some upgrades in radiology. I got to actually be one of the patients that had to have some of that used. I was very appreciative I didn't have to travel to Rapid.
Right.
We've seen the oxygen tank go in. Really cool stuff. What other things like that do you see happening here in the relatively soon?
Well, I'm gonna hope that it's soon. I gotta get our cash bumped up a little bit. But really, we have lots of good ideas for updating our chemistry analyzers so that we can do more tests in-house and not have to send them out. We have a CT to upgrade. That's really important. We're doing some additional work with our IT piece to see if we can improve the services we have from there. So, and then when you bring in providers, you have to make sure you have what they need to be able to do their job. So there's planning relative to if you want to do endoscopy, there's equipment and purchases that you need to make to do that. And that's one thing I mentioned about the levy too. Without the levy money, it makes it really harder for us to be able to do those expansions. I really actually believe if we don't get the levy, we won't be doing expansions. Not hardly any. And that's not I'm not saying that to be, scary. I'm just saying it to be truthful, that we really wouldn't be able to afford to do stuff.
That pill sorting, counting, whatever it is, down in the pharmacy, how has that issue been fixed?
Yes, they've got it working now and they're doing training on it, and they've got this new machine they call Fred. Is it Fred? Yeah, Fred, but it's with a PH. So Fred is their partner now, and they're working on getting that done. And we've actually been working on being able to scan our medications and safer medication practices because we have some of those things in place now. So some equipment that doesn't sound all that exciting really is quite exciting. I call it, there's some stuff that sounds sexy and stuff that doesn't. Like HVAC doesn't sound sexy, but we have to improve our HVAC system. And so those are some of the things we need to do. Yeah. Yes.
I'd just like to address a couple issues.
Okay.
One, you asked about providers. Shannon Ballard and Patrick Leeson and I do most of the ER and the inpatient. I think they really do a good job. I'm proud to work with them. They like people, they get along with staff and the patients, and they do a good job. We do have occasional ones from outside the community, but it's the minority. Another concern that I hear a lot is that we're a Band-Aid station. And that's just a function of how medicine is now. As most of the doctors say, well, I only deal with the left eye or the right hand or something. It's just a population-based issue. And even Gillette, we try to send people there. They say, well, we don't have a lot of the specialists for that. It's just, no small community is going to have very many specialists. So it just can't be helped. I think the other side of that is that we can stabilize people here. If they have a heart attack, they can get a clot buster.
Right.
Stroke, the same thing. Trauma, they can be stabilized. But then they need to see a specialist, and that's just how it is. The other thing I would like to second what Shannon said about Kathy. I think since Kathy's been here, there's just a different atmosphere in the hospital. People are happy and relaxed, and I'm just very encouraged with Kathy and our new staff that things are going to be a lot better. I know we've had some bumps in the road lately. We're really hopeful that things are better already and going to get better.
Thank you.
On a personal level, Dr. Franklin, I've never thanked you. You saved my life when I had that heart attack and it was a blood clot. And for that, I thank you.
Our pleasure. We're glad to be able
And a
to
few
help
couple other people that were here that took care of me during that.
you. But we can do things like that even though we aren't specialists.
Did you have another question?
Not really a question, but a comment. I was so impressed with that young man. He was a high school student. He turned name to somebody, and extremely enthusiastic, caregiving. It was nice to have. My dad really liked to have a man who didn't shower. But
No.
It seems like the high school might be an untapped, or relatively untapped resource. These seniors don't have to go to school all day like we used to.
Right.
They have lots of free time, and they have an internship program, but apparently the kid has to initiate it and go out and say to a business, can I come be your intern? But what about maybe recruiting a little bit
Yeah, I think that's important. We do have some high school students that have been here already, and even college students that have done interns here. So we're very open to it, but we could probably spend a little more time advocating for that through the newspaper and radio spots and things like that, so we can get people interested in doing that. But we do get some.
They do go, like the dental office, a lot of people in there started out as high school interns and then they became dentists or hygienists or something. The same with the eye clinic. If kids get interested at a young age, then rather than go to college and say, I don't know what I want, but I'm here, they've got a direction. And heaven knows a lot of them need direction these days.
Well, and the nice thing about this community, in my opinion, but I have a family that lives out on a ranch here in Newcastle, but I've been back and forth to Newcastle for 30 years at least, and before I moved into the community, and there really is people that have lived here for generations and generations. I think that's good, and I think that those are good people to tap into, because a lot of the kids here stay here. So I think you make a great point. Thank you. Yeah.
Just off the top of my head, I can think of one person on our staff, Sinead Alberts, interned here, and she is now back in her community, serving all of you, and we appreciate her very much.
As far as the recruitment strategy, these are things that we are working on. I've only been here, I think, 5 or 6 weeks, so we've been going through a lot of different items, but we do have in the process a recruitment strategy that we are working on. Getting in the high school is actually a part of that. I think partnering with the local school and with the colleges that are here and there are our next pipeline of employees. So we are looking forward to that. We are working on selling the community as well. We've changed some of our advertisements for radiology to just sell Newcastle to the outdoorsmen, because there are people that have a zest for life and they would find a good life here if they can provide services that we can't find somebody local. But to your comment, the high school is an untapped potential. In Michigan, I went into the high schools. They also sent students to me, and we did tours, and I took them all around. They saw, one of them got to see a endoscopy, left the room, wanted to become a sterilizing surgical tech. And so we helped them. We showed them that there were resources from the state, resources from the hospital, because these are our future employees. So getting them in and getting over there to them is a huge thing, because you will have people in this community that are teenagers that are in high school. They don't maybe want to go to college traditionally, but they want to do something. But if they don't want to work in the mines, then we can show them throughout the hospital. There are a lot of professional people in our organization and a lot of jobs throughout the organization that they are qualified for, or that we could help them become qualified for them. So this is something that Kathy is wanting to do, and we are in the process to make those steps. But very, very precise what you're saying is that is a great pipeline, and we are going to utilize it and utilize it better.
Kind of tying on to that, because one of the things you really sparked a memory that I've had here that people talk about is that the kids grow up, they get into the high school, they go on to college, and then you never see them here unless they're visiting their parents, and then their parents move away. So when you're talking about the recruitment of the high school, you also need them to stay. What types of things do you think would be good to make it where they would be they'd be wanting to stay in Newcastle, in Weston County?
In addition to the weekly printed version of the newsletter journal, we also promote our community and share important information on our award-winning website, newslj.com, and in our weekly email newsletter, Nuke Now. We also connect with readers through various social media platforms and invite you to check us out on Facebook, Twitter, and Instagram. You can even take a look at a recent meeting of the City Council, School Board, or County Commission on our YouTube channel. We do hope that you will go to newslj.com and subscribe today, and we look forward to making all of our great content available to you. But regardless of your level of support, we thank you from the bottom of our hearts for doing your part to preserve a free and independent local press.
What types of things do you think would be good to make it where they would be they'd be wanting to stay in Newcastle, in Weston County?
Most rural communities have the same kind of problem. I've seen, some teenagers are ready to turn 18 and they just want to get out and go live in a big city. I have seen a lot of them do that, but return because they get to the big city and it's not like what they thought it was going to be. We got a lot of great employees here. Yeah, there have been some that have left, but there are so many great employees that are a part of this organization that started in that. Maybe they came back. I've talked to several who said, well, I kind of moved away, but then I came back. The incentive, I think, is there because you will have a lot of high school kids who don't want to leave. I see them in the pizza barn or downtown with their spurs and cowboy hats on. They love Wyoming. They love the lifestyle. So the way to sell them, if we're going to use that word, or to get them committed to the organization, is to invest in their future and let them know we are going to help you along. You get in and you start working, and we're going to, you see something that you want to do, you want to become an accountant, you want to work, that's the process. But also, I have done in the past some different incentives to, whether they be education incentives, to help people go become we do pay and help become CNAs. They can be medical assistants working in clinics or in other departments. So I think showing them what's possible for them, for their future, right here in town, and then to invest into their lives through grants, and there are grants, there are different services that we can look at to help them get more of a trades education through what we can provide them. So I think you do that a lot of ways. It's culture. Culture is a big driver. As it's been said many times since Kathy started, the culture is beginning to change, and that does take a long time. Normally for any organization for you to see that inflection point. But I see it every day and in the community about how honest and open Kathy is, and they like that. And I appreciate that too. That's why one of the reasons I'm here is because of that. So I think that if we can show that we're investing, it's always a process. It's something that we have to invest ourselves into, and that's one of the things that HR is doing, is trying to be what the hospital needs it to be. And earlier you asked Kathy a question about retaliation, confidentiality. Those are the things that the HR department is really working on, is to be that stopgap. Yes, I'm a member of the executive team, but I am an advocate employee that we have, and so is Kathy. And so we don't see any of that as we will not tolerate any retaliation or any sort like that. We are up and up and black and white. But back to it, I think, Melissa,
I just wanted to add on to that we have several staff members now that currently come in as an NSA, which is the nutritional support aide, and then they will voice interest of wanting to become a CNA. So we definitely support that from within. What we do is we pay their tuition for that. We're trying to look at doing over Christmas break another CNA class. We did one last year, so that way the kids who are in high school can come and do that class while they were off school, not having to worry about missing school. We have several high school students who work who come in after school. They'll work until about 10 p.m. helping to put residents to bed who are CNAs. They started out as an NSA, so I've seen them go from NSA to CNA. Then they express an interest that they want to do CNA 2, which is just a little bit higher of a CNA. They can do a few more tasks. So of course we pay for that tuition as well. Then they go on to be med aides, where they are able to pass medications as well. So we definitely promote from within. I can probably count at least 5 people in my head right now who I know were here before me, but continue to be here because they progressed from an NSA all the way up to one right now in my head I can think of as an RN. And Weston County helped promote that, and definitely wants to promote from within. So anybody who comes to us and expresses that I want to better my education, we are there to support them. We are there to provide that tuition support for them, and definitely better them on the way. If they want to switch departments and kind of grow within, they also promote that as well. So that's helping them to stay in the community and helping them to stay here and not to be burnout per se, and maybe some of the positions that they're currently in. We have a lot of lateral transfers, and we promote that as well because it also helps us as a community retain that good employee that we know that they are.
Another department where that is where we just recently, when I got here, one of Kathy's first things was the training of pharmacy techs in-house. So there's a lot of opportunity. There's more that we can do, but I feel like we definitely are on the right track.
And to add to that, as a parent, I have 3 teenagers at home, all in high school right now. And I think teenagers sometimes get this idea in their head. I was talking to 2 of them about working in a hospital setting, and one of them said to me, well, the only thing you can do is be a CNA. And I was like, well, whatever gave you that impression? I mean, there's so many jobs, and I pulled up a list and I showed her up the top 50 jobs you can do with less than 8 years in school. Because that was the other thing. She said, well, I don't want to go to school for 20 years. And so I think it's important that the kids know that they have a lot of options. They don't just have to be one thing. They can do a lot of things, and they can do it without 20 years of schooling. So I think that they're doing a good job of letting these kids know that they don't just have to go into the hospital and work one job. They can do many things.
I don't know if this is a fair question, but a person support himself on, or herself, on the salary of a CNA or a whatever, CNA 2 or some of these other, can a person live on that without having a spouse who's also working?
I think that I worked in McDonald's for a while and stuff like that, Wendy's and Burger King. We had to sing that silly song that people ask us to. But I can tell you that you start out not making the wages that make your lifestyle the way you want it to be. I think you do struggle. And so I'm not going to say that a CNA, I think we pay CNAs pretty well for the market type of place. But do I know whether or not they have everything they need? I would say I don't know that. We just try to go by the market standards and make sure that we're doing what's fair in the market for them. And we are doing some things to try to make the insurance more affordable for families and kids this year going forward. Kids, the staff, so that they can afford their insurance better. So we do things that we can do to try to support them. But I think your job, I started out when I started out as an LPN, because I was an LP at one time, we made $4.95 an hour. So things have changed a lot since I started in healthcare. I couldn't even imagine paying somebody $4.95 as an LPN or a CNA for that matter. So the economics piece, I think it's what you want, what you're comfortable with. I'm really answering that question. You start where you start, and then you build yourself to where you can go. And it really depends on your family's dynamics and what you're motivated to be able to do. We certainly encourage people to move up in their salaries and stuff, but I don't want to quote what our salaries are for CNAs, but I don't know that answer, so I'm not going to do it.
I do have a young CNA that works full-time night shift, and she is able to live, pay for all her bills, and not above, but she makes ends meet.
I have several CNAs over at the manor as well, who are single moms with maybe 1 or 2 kids, and they are able to provide for their families as well, so that's what I wanted to know.
Yeah. That's good. Yes.
So another major concern of the community is the financials. It's been, I guess, they were kind of in arrears, or you didn't actually.
That would be an understatement. So, when I got here, I'll speak since June, okay, we had bills that hadn't been paid for, like 120 days was some of the earlier ones. We had some that were even not paid for their annual charges and stuff several months out. So we had to do a lot of catch up on bills. And because we did that, we also had, I really don't know what happened that the wheels fell off, but the wheels fell off of some of the work and bills were not getting paid. I also think some things went to the dark hole and just went missing, and then we had to find those bills to be able to pay them. But we're paid up current now with our bills. We're doing much better with that. We have had to spend cash to get there because there was a lot that wasn't paid for quite a while. So we're sitting right now with about $1.9 million in cash. I say that loosely because we're still working to reconcile 2024 GL stuff, accounting pieces. So we're still working on reconciliation. It was about an 18-month, an 18-month something that I can't figure out what happened. I just don't know what happened. But luckily, or unluckily, we were working kind of like a cash place. And so I think that that's not how we normally work. We work off of GLs and ledgers and accruals and all those kinds of things. And we were kind of doing a cash basis piece, and I don't know why bills didn't get paid, but we got them caught up. And we're feeling like we can stay caught up with them now. And we were spending, one month, we had to spend over $1 million just to be able to get caught up. And now we have looking at cash on hand types of things. We are at the place where a month ago we had 7 months worth of cash on hand. So this month we have 8 months worth of cash on hand. So we've actually been able to reduce our expenses and at the same time have more money that we're have more money to work with for a little bit longer. So it's about us being really, really diligent about the money and how we spend it. So back in 2019, they got some infuse of money for COVID and all of the things that went with that. They went, and the problem is about 2018, they were really getting by hand to hand and mouth to mouth. And then it's like they got the infusion of money, and it's sort of like they forgot about it feels like they forgot about how to plan for your future a little bit. And now we're having to go back and make sure that we're doing that and building up our cash flow and building up our future. So
as far as like budgets, will the public see that part of it? I mean, you ask the public for money, they kind of like to know where the money. I have a faithful reader who comes into my office every couple weeks, and he's where's the money at the hospital? Why aren't you writing editorials about it? They need to be showing us,
Well, I think we're starting to have documents. I mean, when I first got here, I couldn't have told you what we had, except for the cash in the bank. I couldn't have told you what we spent, and I'm only getting better now at understanding what we spend. And so I think that when I first got here, it was I've never worked any place where we didn't have financials. We're finally getting maybe within 2 months of being able to have true financials. And right now we have things like cash flow that we use, and all of our various delinquencies that we're taking care of. All of that stuff is in some documents that we bring to the board and talk about in the finance committee. So we're trying to become more and more transparent. I think that why we didn't look transparent before is because, quite frankly, we didn't know what we were doing. That sounds harsh, but it's the truth. We didn't know what we were doing. So, that's no offense to anybody that's been working here forever. Your leadership has to be strong enough to be able to lead people, to be able to do what they need to do, and that's where I'll leave that statement. But I think that just ask those questions. And I have had people call me and ask me straight up questions, and I answer them. So if there's something you want to know financially, but we're still working to have an actual financial balance sheet and a P&L and those kinds of things. And we're behind on that just because we don't have reconciliation done all the way for 2024. So we've got to get that done so that we actually really know where we land.
And your new CFO will kind of
the
help with that?
Yeah, the CFO we've had an interim. He's been doing a really, really great job. And then the CFO that's coming has 35 years of rural health CFO work. So she's worked very long time in the business. We ask her really tough questions. She knows how to answer them. She's not afraid of what we have here because, not everybody wants to jump in the pool with us. But she's not afraid to be able to do that and help get us right. We worked really hard to find the right people for the right positions so that we don't ever go back to what we had before. So,
thank you.
Mm-hmm. What would be your top, and this is for all the leadership that's here, your top 1, maybe 2 goals?
Well, one of my top goals is to be able to have actual budget numbers that we can share with people, you know, that fiscal responsibility is shown there. So I want to be able to show that we're being fiduciarily responsible, that we're making sure that our people have jobs and things are going to go forward and we're going to grow. So I'm kind of condensing it all into, here's the things we have to do to be able to do that. We want to be able to recruit people. Some people may be back into the facility that left, and we want to be able to recruit new people that we need. Those are my first couple that I can think of. I think building the cultures, you know, is part of it, and because if you don't have the culture that you need, sometimes it affects how we do with our community. So I personally think this staff has been incredible. They've taken really good care of people in spite of all the things they could have been worrying about or were probably worrying about. They did an incredible job that way. So I'm not worried about the staff. I think they'll do incredibly well going forward, but it's just a matter of us doing our job to make sure that they feel comfortable in their jobs. Anybody else?
Does like to say anything?
As far as our goals, anything else?
Having been in some situations where you come in, I mean, there's one thing that has definitely stood out to me is there's staff here that cares. When you have that opportunity to do it, is building on that, so that's huge. I think that's all our goals is to build off that and make this the best we can.
I would echo that. For me, along with those are ensuring that the integrity of HR and our processes, and we're working towards that. And I think that, like I said, we have a tremendous staff. So I would say also getting the resources into our staff's hands, because we've had a lot of people who wanted training and wanted help. And we want to make sure that they are able to do their jobs the best that they can. And that when, God forbid, they are no, maybe they were working for 2 years, 20 years. Whatever we do, we want them to have been, when they leave us, we want them to have been better than when they came. So I think that's a part of all of our goals, are to help our workforce to be the best workforce that they can be and to give excellent patient care.
Not wanting to sound like the view of Bala, but what would you do differently than what was done with the previous leadership?
Well, I would have kept my eye on the ball. And I would have been paying attention to what's going on in the facility and paid attention to my employees. I would have made sure that we were in a good pace in the financial as much as we could, or financially. Because CFOs and CEOs say no money, no mission, and no mission, no money. It's the same thing. You have to have money in order to be able to serve a mission, and you have to have a mission in order to serve the purpose for you to receive money, right? The community's pieces. So I think what I've learned from it is, well, I mean, I really would say wake up. That's what I would say, and pay attention, and don't let people down, or don't do that kind of thing. Deal with the tough stuff. Be an honest person.
It's hard to speak to what was. We can only really speak to what is. And we just want everyone to be successful.
Well, the staff really spoke to what they felt. They weren't happy with previous leadership. So we need to not be the opposite of that. Right? And so, hope I didn't say too much, and I try not to deface anybody, but you know what I mean? It's like, pay attention. That's what you have to do. Do your job.
You have any closing comments, anybody?
Anybody else?
Thanks for having this meeting.
Yeah.
Just, I've been here for almost 26 years, so I've seen a lot of come and go. But by far, Kathy is probably one of the best. The last person, I will honestly say I was afraid to go to because of retaliation. But with Kathy, and you, I don't know Jake that well yet, but I even feel like you're more comfortable with him. So for me, yeah, she's a blessing, and with Shane now on board, I think we are just really headed in a very good direction as a whole. I hope they all stay.
Oh, Lisa's getting a Snickers bar on her desk.
Can I read a letter that some of us put together?
Sure.
My name's Keisha. I'm from the radiology manager over here at the hospital. Can you hear me okay? If I have cases.
If you can use that, it would help.
Okay. So we titled it Support Your Community. Many of the employees here at Weston County Health Services wanted to reach out to you, our community, to thank you for the amazing support over the last year and ask that you please continue your strong support in the future. To do this, we decided to write this letter to let you know, from our standpoint, how things are at the hospital. As previously stated, we want to thank you from the bottom of our hearts for your strong support over the last year when we could not speak for ourselves. For being there and ensuring the previous administration and the board heard you when one of our coworkers was treated unfairly. The outcome of the situation may have not been what we all wanted and asked for, but we believe the outcome was better than it could have been because of your support. Thank you for attending numerous board meetings and asking important questions about our financial status, and for letting the board know that you will be more attentive to how our money will be spent from now on. As we progress forward, we would like to let you know how it's going now. Our new administration is very supportive of the employees, and so much of the fear and pressure is gone. Our interim CEO, or our CEO now, is kind, caring, and willing to listen. Her priority is to make sure our hospital will recover from the losses and that our community receives the care they deserve. She's assembled a new team with the interim CFO, who's helping with finances, and our new permanent CHRO. Together, they are ensuring that communication with everyone is a priority, including the rest of our hospital community. No more secrets, everything is out in the open. We feel like we are part of the team again and able to do our jobs the way we are supposed to. We truly believe that WCHS plays a crucial role in this community. We are lucky and privileged to be able to go to our local hospital, receive excellent care quickly, and have community members take care of our loved ones. The comfort of knowing our caregivers are people we know is priceless. The employees of this hospital are your fellow community members. We, just like you, understand that rebuilding trust will take time. However, the ability to have health care in our hometown, reduce long travels to get help when help is emergently needed, and the difference that we know we can continue to make in people's lives when they need it most matters to us. For the employees of this hospital, there is so much more on the line. We need our jobs to be able to support ourselves and our families. If this hospital does not recover as quickly as it could with your support, some of us could be without a job and would have no option but to leave. We acknowledge the hard work, dedication, and grit it will take to achieve our goals. We believe that together we can do this. We appreciate your support, and we really hope that you continue to support your community hospital and fellow community members. We are Weston County Strong. From the bottom of our hearts, thank you.
Okay, well, if there are any other questions, if not, I appreciate all your time. You guys took the time out to be here, and I really, really appreciate it. Thanks for the questions. They can be hard or easy, either one. I was praying it wouldn't be too many I couldn't answer. So I think we did pretty good. And I just want everybody to know there's a 2 o'clock one too. You guys have gone, but let everybody else know we have a 2 o'clock town hall meeting as well. Yeah.
I feel really good. Thank you for doing this meeting.
Sure.
And I wish more people could be here because there's a lot of doubt, unconfidence, whatever word that is, a lot of doubt because of stuff. And I think if more people had been in on this meeting, they would not question voting for the meal levy. I feel really good about just the impression I get of you.
Thank you.
And I think if everybody could have been to this meeting, we'd all feel better about our hospital.
Thank you.
They
We are
will be able
streaming it. We are streaming it, so hopefully we got a few people online too. Well, thank you so much for your time, everybody.
Thank you.
Thank you.
We'll have the educational flyers, they're going to be right here. You take them, pass them out, leave them.
Again, I respect him coming into the Lion's Den. Weston County is notoriously conservative. And JD came in and stood at the front of a room where he knew he was in the minority and took questions, which is better than I can say for others from that wing of the party. That's my problem. So you know, Chip not getting a chance to respond, hey, through no fault of our own or no fault of the Freedom Caucus, because the Freedom Caucus shows up, they've kind of had the stage to themselves. But for JD Williams to do something that you know, Ogden wouldn't do, you know, Liz Cheney wouldn't do, I mean, who he gets lumped in with, he came right up and he saw people and he talked to people.